wall push-up? All right, ready? We're gonna find a wall. Molly, we're coming over here for our wall.
There's a wall right there.
You're right, AJ. We're coming over here. All right. So, patient's position, their feet are going to be shoulder width apart, about 2 feet away from the wall. A little bit further back. A little bit. Right there. Okay. Now, what I want them to do at first is to go ahead and put their hands on the wall at the level of your shoulders. All right. Then, once you've established the level of the shoulders, you want them to go down a little bit, maybe 6 or so inches. Okay. Right there. Okay. Now, how to perform the test? Well, clinician is going to be behind. How to perform the test? She is simply going to go ahead and do a push-up on the wall and then back. So go ahead and do one. She goes down and she comes back up. Okay, stay there for a second. When she does that, if the vertebral borders of the scapula wing up on either side, that is the positive finding for serratus anterior weakness, which is most likely caused by pathology to the long thoracic nerve. Okay, you can relax.
Gerber lift off test.
All right. We're gonna have you stand. Could be seated, but it'd be awkward. All right, you're gonna face that way. We're gonna do your right side. What I'm gonna ask the patient to do is to take the back of their hand and put it in the small of their back, just like this. This is a test for subscapularis weakness or pathology. So your subscapularis muscle does internal rotation. So imagine she's kind of internally rotating right there. What we're asking her to do is to go ahead and lift off her hand from her lower back, but we don't want her to do it with just lifting the humerus. We want her to try to think like she's internally rotating it. So go ahead and just try and lift it off a little bit, especially there. Okay? Now, you can relax, just keep it like that. If this is a test where we're trying to decipher if she has weakness, I can't do that unless my hand is on here providing some resistance. So she's going to go ahead, I'm going to stabilize her so she doesn't move, go ahead and press again, lift off your low back, press against my hand right there. That's how I would determine the strength that she's doing. If I really wanted to get ticky-tacky, I could have her do this in the prone position, because now she would be doing it against gravity. But this is a test for subscapularis pathology, partial thickness tear, and it's evident by weakness compared bilaterally.
Jurgensen's test.
It's a fun one too, especially with spring training coming along. All right, Jurgensen's test. The easiest way of thinking about this is thinking of a baseball or softball umpire calling somebody out. They're doing this motion, you're out, okay, just like this. So what am I doing when I'm saying you're out? I am doing some external rotation, I am doing some supination, and I'm doing some elbow flexion. So that's the motion the patient is doing. I'm resisting them when they're doing it. So we're gonna start her in this position, which means she's gonna be internally rotated. There's gonna be some extension to her elbow, and that the back of her hand is gonna be facing forward. Perfect, just like this. Now, what I have to do is the first thing, I have to make sure I have my hand or a finger in her bicipital groove. So somehow with my other hand, I have to resist all of those other motions. I typically do it by grabbing somebody's wrist. You could provide some resistance here. I've seen people that are shaking hands and do it. The important thing is I've described what she's doing and I'm resisting it. So you're going to be going, you're out like this, and I'm going to go ahead and be resisting you. So keep your elbow at your side, go ahead and do it, just like that. Now, what structures am I testing here? If she has pain in her bicipital groove with no popping going on, she has LHB tendinopathy. If I feel a popping in her bicipital groove, she has an injury to her transverse humeral ligament, so she has a subluxation of her LHB, long-hemmed bicep. If she complains of pain underneath the acromion, so that's going to be superior to where my fingers are, that is suggestive of a slap lesion. Anytime you use the bicep muscle resistively and they have pain there, you think slap lesion. So those are the three things that this is testing for.
Speeds test.
Speeds test. Okay. They can be standing or seated. We'll have you standing. This is a resistive test. So I'm going to be off to the side. Let me describe what she's doing. She's going to start in the anatomical position, and I need to take her through both full shoulder flexion and full elbow flexion. The tricky part of this is if I'm resisting it, I can't have her do all of shoulder flexion first because I'm not tall enough to reach all the way up there. So I'm going to tell her to go ahead and flex her shoulder until she gets to 90 degrees. Once she gets to this point, I'm going to ask her to flex her elbow as far as she can go. Then I'm going to ask her to continue flexing her shoulder some more. And I'm going to resist that. So, my position along the side, one hand, I have to stabilize the clavicle, the scapula, but have my finger in the bicipital groove. That's right there. With my other hand, she's going to be supinated here. I'm going to resist down by her wrist. I'm going to go ahead and resist her as she first goes through shoulder flexion to 90 degrees. So keep going, hard, 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 hard. Now flex your elbow, keep going, hard, 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 hard. Now flex your shoulder, keep going all the way up, all the way up, all the way up. So, ideally it's going to be a little bit of one continuous motion, but it's difficult to communicate that to your patient. What I am looking for here, if she has pain in her bicipital groove with no popping, it's LHB tendinopathy. If she has popping in the groove, it's LHB subluxation. If she has pain underneath her acromion process, it is a possible slap lesion.
Ludington's test.
This one you are going to have to see. Have her sit right there. All right. Patient is seated, clinician is behind. What I'm going to ask my patient to do is to go ahead and interlock her fingers and go ahead and put them on top of her head. Just like that. And keep your elbows out to the side. That's good right there. Actually, put them down for a second. Let me figure out my landmarks here. I got to find the bicipital groove. All right. I've got it. Go ahead, interlock your fingers, put them on top of your head. That's right there. So with my fingers in the bicipital groove, what I'm now going to ask her to do is push down on the top of her head. So push down. Go ahead and relax. Push down again. Relax. Okay, you can push your arms down. So what is she doing? My hands are in her bicipital groove, so I'm feeling for her LHB. When she pulls or pushes on the top of her head, she's contracting her bicep. If both long head of the bicep tendons are intact, I will feel both of them pull tight when she pushes on her head. If I feel the tendon on one side, I don't feel it on the other, that is suggestive of a rupture. This is not a subluxation, this is a rupture of the long head of the bicep tendon. What's next?
O'Brien's test.
Oh, it's not fun. We're gonna have to stand for this. I don't know why I like this test. All right, so, let's have you sit. Hop up here. You can sit for this. Standing or seated is fine. She has good posture. What I'm going to ask her to do is actively flex her shoulder to 90 degrees. Then I'm going to ask her to actively horizontal abduct it 15 degrees, so you're just bringing it across your chest. Then I want you to, whether you pretend you have a can in your hand or just turn your thumb so it's pointed down. All right, so right there. Clinician is going to be off to the side. I'm stabilizing her clavicle and scapula with this hand. And I'm going to provide a downward force with my other hand. Same mechanics apply to this. You're better off providing the resistance here so you're not recruiting these muscles. If someone's pretty strong, you might have to do it a little bit lower. So I ask her to hold her arm in that position and resist me as I push down, hold it up there. So first I do it thumbs down. Now I ask her to do it thumbs up. Same position, hold it there, I'm gonna push down, and then relax. All right, this is testing for two things. This is testing for either a SLAP lesion or it's testing for AC pathology. So, it is a SLAP lesion in this situation. If the patient describes pain underneath the acromion process, when the thumb is down, that is relieved when the thumb is up, that's the SLAP lesion. It is AC pathology if the pain is within the AC joint, both with the thumb down and with the thumb up. And that's because it's got nothing to do with the positioning of the humerus other than when it's across the body, you're pinching the AC joint.
Jerk test.
Which test?
Jerk posterior stress test.
What else do I have on there? Because I think I might want to combine this.
That one and then apprehension for GH posterior.
Yeah, I'm just going to do the jerk test just as one test. We're not going to worry about the GH posterior. All right, let's have you supine, head here, feet down here. So now I need your body so that this arm is kind of off the table. Right, just like that. So I said you don't have to worry about the GH posterior, only because that test, what I'm doing is in this position, I'm pushing her down. When I do the jerk test, I'm doing the same thing. So in this position right here, her scapula is on the table, but I'm going to help hold it there. So I want you to go ahead and abduct to 90 degrees. Okay, you're just going to let your elbow kind of relax there, and I'm going to hold here. I have her coracoid process with my thumb. My hand is holding her scapula. So for the jerk test, I'm doing an axial loading force along the long axis of the humerus, and I'm keeping that axial loading force as I'm moving her through horizontal adduction to 90 degrees. That's why I'm saying the jerk test also does the GH posterior. So what is this a test for? You can relax. This is a test primarily looking for the labrum and the posterior capsule. The positive findings here, it's more suggestive of a labral tear when there is an audible or she feels the click and pop. The other structure that's going to be involved is the posterior capsule as I move her into 90 degrees of horizontal adduction. So as it comes up and I'm pushing in the posterior direction, it's stressing the posterior capsule.